Good morning wherever you are. This is Orion Reed from ConferenceHype. Our segment will focus on oral step-down, optimal drug, and total duration of antibiotic treatment in African children hospitalized with severe community-acquired pneumonia, a factorial randomized controlled trial. From the 2026 July 31 edition of the Lancet, background coronary artery bypass grafting is a common but invasive operation traditionally performed through a median sternotomy. Methods: MIST was an investigator-initiated, international, open-label, randomized controlled trial done at 7 centers in Canada, India, China, Germany, the USA, and Japan. Results: between August 24, 2018 and November 26, 2024, 176 patients were enrolled, 170 of whom were randomly assigned to MICS-CABG or sternotomy CABG. Discussion: these findings support consideration of MICS-CABG in appropriately selected patients treated by experienced teams, and further studies of implementation, recovery pathways, and long-term outcomes. From the 2026 July 28 edition of The Lancet, background pulmonary arterial hypertension is a rare, progressive disease characterized by elevated pulmonary vascular resistance that can lead to right ventricular failure and premature death. Methods: advance outcomes was a randomized, double-blind, placebo-controlled, event-driven, Phase 3 trial of ralinepag in patients with PA. Results: patients were enrolled between January 24, 2019 and June 20, 2025. Discussion: funding, United Therapeutics Corporation. From the 2026 July 29 edition of The Lancet, background Duchenne muscular dystrophy is an X-linked genetic disease of skeletal and cardiac muscle that leads to loss of ambulation and premature death due to progressive myopathy and cardiomyopathy. Methods: HOPE-3, a Phase 3, multicenter, randomized, double-blind, placebo-controlled study, included participants aged 10 years or older with DMD. Results: between June 22, 2022 and May 28, 2024, 139 participants were screened, of whom 106 were randomly assigned to deramyocel or placebo and included in the intention-to-treat population. Discussion: funding, Capricorn Therapeutics. From the 2026 July 29 edition of The Lancet, background psoriasis is a common, chronic, immune-mediated skin disease affecting more than 40 million individuals worldwide. Methods: psoriasis, along with psoriatic arthritis, are part of a broader psoriatic disease spectrum and present with inflammatory skin and musculoskeletal manifestations driven by shared genetic, environmental, and immunological mechanisms. Results: beyond cutaneous manifestations, psoriasis is associated with a substantial psychosocial burden and a wide range of comorbidities, including mental health disorders and cardiometabolic diseases. Discussion: advances in understanding the key role of the IL-23-IL-17 inflammatory axis and related immunogenetic pathways have redefined psoriasis as a complex immune disorder, leading to the development of highly effective targeted biologic and small molecule therapies that modulate cytokine signaling and intracellular pathways, offering improved disease control across cutaneous and musculoskeletal domains. From the 2026 July 25 edition of The Lancet, background dislocation is the most common early surgical complication in patients with hip fractures treated with total hip replacement. Methods: we included people aged 65 years or older with a displaced femoral neck fracture, attending 20 Swedish and 24 UK hospitals in this pragmatic, registry-based, randomized superiority trial. Results: between January 9, 2020 and April 2, 2024, 2934 eligible patients were screened, of whom 1334 were not enrolled, mainly due to surgeons' preference because they had already been treated at the time of screening, or because informed consent was not obtained. Discussion, funding, the Swedish Research Council and the National Institute for Health and Care Research. From the 2026 July 30 edition of The Lancet. Background, zenagamtide is a unimolecular peptide agonist of GLP-1, amylin, and calcitonin receptors. Methods, this 36-week, randomized, parallel, double-blind, placebo-controlled, dose-finding, Phase 2 trial was conducted at 83 hospital and clinic sites across 11 countries. Results between August 7 and December 27, 2024, 186 of 915 screened participants were randomly assigned to oral zenagamtide or placebo and were included in the full analysis set. Discussion, funding, Novo Nordisk. From the 2026 July 30 edition of The Lancet. Background, zenagamtide is a unimolecular agonist of GLP-1, amylin, and calcitonin receptors. Methods, this 36-week, randomized, parallel, double-blind, placebo-controlled, dose-finding, Phase 2 trial was conducted at 83 hospital and clinic sites across 11 countries. Results between August 7 and December 27, 2024, 262 of 915 screened individuals were randomly assigned to subcutaneous zenagamtide or placebo. Discussion, funding, Novo Nordisk. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of The Lancet. Background, a contemporary standard of care for patients with metastatic androgen pathway modulator naive sensitive prostate cancer is androgen deprivation therapy plus an androgen receptor pathway inhibitor until progression. Methods, PSM addition is an ongoing, randomized, controlled, Phase 3 superiority trial conducted at 169 sites across 20 countries, including hospitals, medical centers, and specialist cancer centers. Results from June 15, 2021 to July 25, 2023, 1529 patients were screened and 1144 were randomly assigned, N equals 572 per arm, 1144 male, 572 with de novo metastatic APMN-S prostate cancer, 779 with high-volume disease, median age 68 years. Discussion, therefore, combining 177 Lu-PSMA 617 with ADT plus ARPI might be a new treatment option in metastatic APMN-S prostate cancer. From the 2026 August 1 edition of The Lancet. Background, alternatives to carbapenems for the treatment of third-generation cephalosporin-resistant enterobacterales are urgently needed to reduce the selection pressure posed by these drugs. Methods, this multicenter, Phase 3, open-label, non-inferiority, randomized, pragmatic, investigator-initiated clinical trial was conducted in 29 Spanish hospitals. Results, 334 eligible patients were enrolled between December 15, 2020 and November 29, 2024, of whom 328 were included in the MITT population. Discussion, funding, Instituto de Salud Carlos III. From the 2026 August 1 edition of The Lancet. Background, venetoclax rituximab following covalent Bruton tyrosine kinase inhibitor therapy is the fixed-duration standard of care for patients with chronic lymphocytic leukemia. Methods, this open-label, multicenter, randomized, controlled, Phase 3 trial was conducted at 152 sites across 22 countries. Results between October 13, 2021 and October 28, 2024, 784 patients were screened, of whom 639 were randomly assigned, 321 to the PVR group and 318 to the VR group. Discussion, funding, Eli Lilly and Company. From the 2026 August 1 edition of The Lancet. Background, Latin America faces a high dementia burden, with increased prevalence of factors associated with cognitive decline. Methods, the LATAM-FINGRS Initiative for Cognitive Change was a single-blind, multicenter, randomized clinical trial conducted in 11 Latin American countries: Argentina, Bolivia, Brazil, Chile, Colombia, Costa Rica, Dominican Republic, Ecuador, Mexico, Peru, and Uruguay. Results: participants were enrolled between October 27, 2021 and July 7, 2023. The last participant completed follow-up on November 7, 2025. Discussion, translations. For the Spanish and Portuguese translations of the abstract, see supplementary materials section. That's it for now for ConferenceHype's coverage of the August 2026 issue of The Lancet. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.